On today's episode of the St. Louis Pain Expert Podcast, I'm going to be interviewing Dr. Marcia Perretto, an expert in hypermobility disorders. I'm also excited to announce the release of my new book, now live on Amazon. It's called Chronic Pain. You're not just getting older, you're not crazy, and it's not all in your head. Learn the secrets to get relief. You can get this book by clicking on the link in the show notes, or I've got a forwarding address set up. It's stlpainexpert.com/book, and it will forward you to the page on Amazon where you can buy your own copy. After reading it, I'd love to get your feedback. This has been a labor of several months, and I've now got a brand new appreciation for authors. So I hope you enjoy the book, and without further ado, I hope you enjoy the show today.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I'm here with Dr. Marcia Perretto, and she's the owner of Actify Physiotherapy, and she's also starting a new unique Zebra network. Marcia specializes in treating people with hypermobility disorders, and I'll allow her to introduce herself and tell a little bit more about what she does and how she got into this really pretty niche field. So welcome. Thanks for being with us today, Marcia.
Hi, hello, everyone, and thank you for having me, Dave. I appreciate the opportunity. So I'm the founder-owner of Actify Physiotherapy and the Zebra Strong Network. At the Actify and the Zebra Strong Network, we focus on patients with joint hypermobility syndromes, the connective tissue disorders, and obviously chronic pain. So I graduated back in 2000, and actually, let's back that up even more, in 1995 with a bachelor's degree in physical therapy in South Brazil. And then I came to the U.S. to further my studies. I got my doctorate at Nova Southeastern University, and then I further followed by acquiring some other certifications in orthopedic manual therapy, nutrition, and finally developing my studies in the connective tissue disorders.
So you've been at this a long time, and you've definitely studied under a lot of different paradigms, not just the physical aspect of it, but the nutrition. And then also, I think you were going to talk a little bit more about the genetic components of some of the hypermobility disorders.
Yes. So yes, I have gone, I believe that the treatment, the body should be treated as a whole and not as a piece of. So if we want to stimulate healing, we're better off coming from inside out as well, not only from the outside in. So the connective tissue disorders, it's a group of genetic disorders to which Ehlers-Danlos syndrome is part of. On the Ehlers-Danlos syndromes, we have 14 subtypes. There are actually more subtypes now that have been identified, but officially categorized, there are 14 subtypes. And each one of them has very peculiar characteristics, but all of them always affecting some sort of type of collagen in the body. For those patients, the main characteristic is the presentation of joint hypermobility, okay, which brings them to experience frequently subluxations, dislocations, and overall joint instability. And add to that, for those that do not fall into the hypermobile Ehlers-Danlos syndrome, They also might be qualified under the joint hypermobility spectrum, which still can have the same impact on their health. From the 14 subtypes that have been identified, the most common with hypermobility, the hypermobile Ehlers-Danlos syndrome, we still don't know what gene is causing it. So it's still being studied. We do know that seems to be of a dominant characteristic, but we still have not identified the proper gene, which makes treatment a little more complex.
So the Ehlers-Danlos syndrome is more of a genetic thing. Can you just define for the people who don't know that are listening to this podcast, just in general, what hypermobility is and how someone might know they have it?
Okay, so hypermobility is just pretty much if you are that child or that adult that amuses everyone else with the tricks you can do by popping off hips of the sockets or bending your fingers in different directions or putting your feet behind your neck and things like that. Or if at early age, your parents always looked at you and said, oh my God, you're double jointed. You can do a split or put your feet behind your head and just rock your body on it. And it's funny at first, and that's the first sign of a possible joint hypermobility situation. We just need to keep in mind that children up to age of 7 can have up to 40% of these children can be hypermobile up to the age of 7. So after that's when we start considering a little more of the joint instabilities. But pretty much if you experience joint dislocations or you experienced in the past joint dislocations, history of subluxations, chronic fatigue, generalized chronic pain, more than 3 joints that have been hurting for more than 3 months, if you have had some sort of pelvic prolapse like bladder or uterine prolapse, these are all signs as well. We're going to be talking a little more about later.
And that's typically, when I see people with these in my practice, they come in as adults that have been having some of those symptoms. Can you tell me a little bit more about how your practice is set up here? Are you getting these people in as children or adults or all throughout the spectrum?
So I have my youngest patient currently is 8 years old, and my older patient is 52 years old. Usually the presentation is about among the ages in between 20 and late 30s. That's when they experience the most of their symptoms, but doesn't mean it couldn't be earlier or later than that. So it's uncommon to have an older patient to come in. I did have one age 78, but she just would come in to continue her stabilization program because she moved from one setting to another, but that was it. She was a very high level patient, but other than that, older patients already develop joint osteoarthritis, and for developing osteoarthritis, they're no longer hypermobile.
So it sounds like there's a detection factor that sometimes this gets missed in the younger kids.
Yes. I think the first thing, one of the first signs that we have noticed by researching is that these children will complain of growing pains, which not necessarily will be the growing pains, but actually they're experiencing true myofascial or joint pain. And the other aspect, these kids will report to feel dizzy and feel with less energy when compared to other children. So in children, that's the most typical presentation.
Okay. And what kind of things do people typically do before they kind of figure out what's wrong, before they get to you or someone else who specializes in Ehlers-Danlos or hypermobility?
So in my experience, what I have observed in all these years of practice is that these patients literally will have gone through different practitioners, different types of medical providers, and they always receive a clear bill of health in most of the cases. So their blood work is normal, the MRI is normal, the X-ray is normal, everything is running fine, and they are still in pain. They're still complaining of the joint-specific pain or generalized pain or digestive issues or dizziness. And many of them are actually labeled as hypochondriacs for that reason.
That's got to be frustrating, and that's common among all chronic pain patients, even the ones some without the collagen disorders. Um,
Yes.
that's got to make them feel incredibly frustrated.
Extremely frustrated. And when I get them and we get to sit down and I take the time to sit down with them and have a conversation on how they are feeling in regards to the path they have tracked so far, and they are very frustrated, they are very hopeless, they are in pain, they're losing strength by the day, they are not able to engage in the life activities they would love to, and many of them have children, they're still growing, or they are in college and they have all the demands of college and they are not being able to keep up with it because they don't have enough energy. So when we sit down and have a conversation, and all of a sudden I start pinpointing to them where exactly why this acts that way and why we have to address this or that way, and all of a sudden you see them smile and say, oh my God, this is it, you get me. You know, it's no longer someone that I'm trying to convince someone, but someone just presented all my symptoms and you understand me. So it's very it makes me feel really good about what I do with them, to be able to introduce them to what is going to be a good path for the future.
Now, once you kind of give them that initial just relief from having someone understand what's wrong and not look at them like they're crazy, what's your process as far as helping these people finally get some relief from the things that they've been struggling with for years, probably in most cases?
Okay, so the majority of those patients will have been going on with joint hypermobility, subluxations, dislocations, skin fragility, scars that don't heal well, slow healing through any sort of injury, pelvic floor issues, loss of balance, lack of proprioception. They fall easily because they tripped over nothing, or they turn a corner and hit themselves against a wall or an equipment. They don't sleep well. They complain of severe fatigue. They might sleep 10 hours and not be able to rest enough, so they are always unrested. They are very anxious. They're depressed, digestive problems. So when we sit down and we start going through every single system, that's what I do. I get their history. I learn their life history. It's not about, do you have this or do you have that? It's about, tell me your story. Talk to me and tell me, how were you growing up? How did you feel with your kid? What did your mom say when you were growing up? So I learned what happened to them from then to now. Once I have all that information, I will do a screening for every single system. So we do a screening and an examination when appropriate for neurological findings, for orthopedic findings, for urinary complaints, for cardiovascular issues. So I screen everything. Based on all my findings, then we will do the referral to the appropriate physician that is going to be necessary to rule out whatever are the concerns for this type of diagnosis as needed, and we will start the approach for the joint stabilization itself.
So it's really kind of a team approach that, because it affects multiple systems.
Yes.
Kind of having a team of experts in each of the different domains that you can refer to help out with
Yes.
nutrition problems or genetic factors or.
Yes. So one of the main points is actually to refer to a geneticist so we can get the right genes looked at. Reason is, well, there is a criteria we use. The criteria is called the 2017 criteria for hypermobile Ehlers-Danlos diagnosis. And that criteria will look into the most important signs that could be related. It's not a perfect criteria. By far, we still feel like there is room for improvement, but it's looked at the distal hypermobility, so hypermobility of the fingers, and then we look at elbows, ability to touch the floor, and then we look at knee hyperextensions. We're looking at it up to a scale of 9 out of 9. In order for them to be hypermobile, they have to have at least about a 5 out of 9, depending on age and etc. From there, we're going to look at skin fragility, scars, and other things that present within the body that's more visible. And then we look into cardiovascular problems, if they have been diagnosed with certain things or not. And if they never been to a cardiologist, we'll do that referral. And then finally, we get to the third and last criteria of the major, which is sent to rule out all the autoimmune disorders. And then after ruling out autoimmune disorders, we'll be sending these patients to a geneticist so we can look at and rule out any other connective tissue disorders that are not the hypermobile Ehlers-Danlos syndrome. So hypermobile Ehlers-Danlos syndrome now, it's a diagnosis of exclusion. We exclude all other genetic disorders that can have joint hypermobility as a presentation, and then the patient is diagnosed with hypermobile Ehlers-Danlos syndrome.
Well, you're one of the few, if not only, clinics in the country that specializes in this type of hypermobility syndrome. So you're very connected and you've got a lot of experts in your field. For people in other parts of the country who may either think they have these symptoms or feel like a lot of what you've described applies to them, how would they go about finding a provider that will be able to help them?
So the first thing is to, the biggest thing now that I see going on is that we need to educate our medical professionals about the syndrome and about the joint hypermobilities, because it's no longer about being a joint hypermobile. Joint hypermobility is one of the symptoms. So the biggest challenge now is go out there and educate medical professionals that this is more than just joint hypermobility, that all the chronic pain, all the depression, anxiety, living in fight and flight mode, having all those cardiac problems and digestive problems, they're all together. They are not separate anymore. And that all professionals should join and talk and discuss each case so we can help each patient. But if you're not local, if you would come in, I would be actually making sure you get referred and etc. I'll be happy to anyway do have a conversation on a phone call conversation. I mean, and help these people. But what I would say is you need to look for first your primary care physician to run some autoimmune disorders and things that are more common to be found. And if nothing else comes up, a geneticist is a great step that understands hypermobile Ehlers-Danlos syndrome. Geneticists will be the first step for you to go then. There is very few people right now that can get the patient started and referring out to everyone.
Now, is there a network or a database somewhere that can help people connect with the right providers?
So yes, there is the Ehlers-Danlos Society, where you can actually go in and find professionals near you. You will see that still the list is not as long as we would like it to be. There is also the HSMA, which is the Hypermobility Society. We are all UK based, but United Kingdom based, for those that don't know. And there you can find a lot of resources as well. There is a lot of videos if you Google them. If you go to YouTube and look for Ehlers-Danlos Society, there will be plenty educational videos on their channel. We are in process of launching our channel too, and we'll have a lot of education there to help these patients. But educating yourself is the first step, so you can actually help guide your clinician to the right findings and ultimately the diagnosis.
Well, you mentioned to me that you're going to be launching, I think, a YouTube channel, as well as, are there any other ways that people can connect with you, both through your channel or
yes, there is the Instagram. Or Instagram is at Dr. Perretto DPT, so Dr. Perretto DPT. You can also look at my website, www.actifypt.com. The zebra-strong.com website is still under construction, but soon will be up as well with a lot of information. And you can also email us. We are happy to answer any questions that people may have at info@actifypt.com. That's our direct email for any questions. So our Instagram, though, we're doing a pretty nice job putting out there daily education on the several symptoms and even sharing connections in different parts of the country.
Well, I'll share all of those links on the site for this blog and in the show notes so that people have access to it if they weren't able to write it down just now. You told me a little bit about the Zebra Strong network that you've mentioned, but for the people who didn't hear our brief discussion before we went live here, can you tell people a little bit about that network that you're forming?
So the idea of the network is to gather professionals and patients under one roof where we can have educational materials, where we can have short videos of exercises that are more recommended over others, considering the aspect of joint instability. We also have topics like fatigue management. We have topics on sleep deprivation and how to handle, recommendations on anti-inflammatory diet, but it's more like a bringing together a lot of knowledge under one roof that we have noticed to have worked best for patients, and that most of the things are already research proven. So we're bringing in all the research things that patients don't have access under an easy platform for them to find the information.
Well, thank you so much for sharing your knowledge and your expertise in this today, as well as some of the different resources that are available to people. Are there any kind of closing thoughts or pieces of advice that you'd like to give to people who are suffering with some sort of chronic issue that may be related to Ehlers-Danlos or some other hypermobility syndrome?
So I think the first thing we would like to always say is definitely don't wait too long to get your treatment. Definitely don't assume that chronic pain coming from hypermobility or not, coming from any source, it's not part of normal aging process. How gracefully we age is really a reflex on how we treat our bodies. And we need to actually treat our bodies with respect and care and look at the signs that it shows us so we can actually have a better aging process. If you are in pain, talk to your doctor, talk to your physical therapist. Don't look just only for a diagnosis as a label, but actually look for someone that can treat you and respect all the symptoms you are complaining about and walk with you side by side in the solutions for it. And the second thing is that chronic pain is really not equal to everyone, and it's not the same origin. So standard exercise you might find on the internet might not make you better, might make you worse. So do not try to treat yourself, without looking for expert advice. You might get lucky, but you might also make yourself worse. So the biggest takeaway, I think, is always look for professional information, always respect your body, and always, I'll always make sure that you are going to the right professionals for your case. If you're not happy with one, consult a second. You don't like the second, look for the third, but find the solution that fits yourself better than anyone else.
Thank you so much, Marcia, for taking the time to be with us today. And I encourage anyone who feels like they need a little bit of expertise to reach out to Marcia. Or at least she can help you get in contact with someone who may be closer to your area if you're outside of where she is. So thank you again, and have a great rest of your day.
Thank you. You too. Have a wonderful day, and thank you for having me.
And thanks to all our listeners. I hope you've enjoyed the show today. And remember, if you'd like to get a copy of my new book, now live on Amazon, chronic pain, you're not just getting older, you're not crazy, and it's not all in your head, then just visit stlpainexpert.com/book, and that will forward you to the page on Amazon where you can get your own copy. Thanks, and have a great day.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.